Caritas, initially, I just thought it was caring, but it's much more than that. It's about the relationship between yourself and others. It's about learning the wholeness of humanity so that we're all connected. And once you actually understand that other people have that same light within them, makes life much better.
Caritas means to me leading with your heart, because when you lead with your heart, people are able to feel that. They're able to know that whatever encounter you're in, it is a heartfelt encounter.
Caritas, maybe at first glance, for those of us who tend to be strong thinkers versus strong feelers, more analytical, maybe seems a little soft and squishy and kind of hard to wrap your arms around. And I think it's actually most important for people like me because, and I've learned this every day through Global Partners, that the way to get things done is by building strong relationships. And the way to build strong relationships is by caring for yourself and by caring for others. And if we forget that, and we don't practice that every single day, work just becomes work. And work really should be about impacting lives and extending love and receiving love from those around us.
Jean's theory really speaks to me because it seems to be how and what we should be doing for caring for our patients. We in healthcare actually are privileged to be here.
Caritas means to me just showing compassion to our patients and families and each other, our coworkers. There's many times that we don't look beyond the diagnosis or the label, and we don't really see probably the needs of the patients. Sometimes we make assumptions on things, and so really also giving them light when they're probably at their darkest moments, and offering them some hope also. And that's what patients really need.
The thing about Caritas is it works everywhere. There's nowhere it doesn't work. I love it that we are looking beyond curing to, we are looking at healing. We are looking at people's physical, emotional, mental, and spiritual journeys.
It's the most powerful because it's that inner core, that inner energy that we all came from. So learning Caritas, you have to be persistent. You have to exercise that muscle. You have to be fearless and know that it's right to love.
Gundersen Health System spans 3 states, Wisconsin, Minnesota, and Iowa, and 19 counties, providing care in both acute and ambulatory settings. Our integrated delivery system has over 7,000 employees and 700 employed medical, dental, and associate staff. We are associated with a variety of affiliate organizations which include ambulance service, rural hospitals, nursing homes, and more. We are a 325-bed tertiary medical center with a Level 2 trauma center. Our Gundersen Medical Foundation provides residency and medical education programs and a clinical research program. Our strategic plan states that we provide care to patients as though they are our loved ones. And Dr. Jean Watson's human caring theory, Caritas, guides us in how we meet this commitment. We are also proud to be an affiliate of Watson Caring Science since 2012. In 2013, Gundersen Health System nurses created a nursing professional framework that has human caring theory, Caritas, as its foundation. Throughout Gundersen, you will see many ways that an environment of healing is created. Our new inpatient behavioral health building was built with the promise of being a place where hope begins. The labyrinth outside this building provides patients and staff a space for contemplation. Our legacy hospital, completed in 2014, offers peace to our patients and families through its use of color, light, space, and many other details that contribute to a healing environment. Walking trails are part of our campuses. a sanctuary, chapel, centering rooms, healing gardens, all contributing to the caring, healing atmosphere. Here are some additional ways we are incorporating Caritas in the healing environment of Gundersen Health System. One of the first things we did was to send 2 of our nurses to attend the Caritas Coach Education Program. The role of the Caritas Coach is to translate and sustain the ethic, philosophy, theory, and practice of human caring into our systems and society. Denise Nicholson and Jill Blackburn graduated from this program in 2012, and in collaboration with our Chief Nursing Officer at the time, Dr. Mary Lou Gerke, and several colleagues from multiple disciplines, work began of expansion by creating the Caritas Circle. This group was responsible for learning about Caritas and generating ideas and a plan for sharing with others. The richness of this group is made even brighter because of a variety of disciplines. The learning we experience through each other and the understanding of our roles and work has added a depth to what we in turn carry into the organization and to our patients. Our circle gatherings start with a centering, helping us become mindful of the work we are doing, as witnessed here with Qigong. Centering before meetings with things such as poetry, music, heart math, storytelling, singing, and guided imagery has expanded to other groups throughout the organization, in councils, the research department, and inpatient behavioral health. Lori Kaufman, a chaplain in our spiritual care department and a member of the Caritas Circle, created a workshop, Spirituality in Healthcare. This workshop helps staff from all disciplines understand their own spiritual beliefs and their role in caring for the spiritual needs of our patients. New chaplain residents experience an educational session of Caritas and also attend a customized heart math session. During a recent healthcare week, our chaplains offered a blessing of hands to staff using essential oils. Kyla Lee is a physician member of our Caritas Circle and as an educator of third-year medical students has incorporated Caritas into her work. She helps her students move beyond the doing to the being to enhance their interactions with patients. Dr. Lee is doing research on the impact to a student's future practice when the evaluation process between student and instructor is purposefully transformed into a transpersonal caring moment. 2 members of our circle, Sustainability Coordinator Tom Thompson and Registered Nurse Phoebe Breed, are highly engaged in our environmental sustainability efforts at Gundersen. With the support and work of Deb Rislow, Senior Vice President, Gundersen Health System received a national grant to help launch a project connecting environmental stewardship and nursing. Phoebe, in collaboration with Tom and other members of Envision, our Gundersen Health System environmental program, have led efforts to engage nursing and other disciplines in environmentally conscientious practices, both in our organization and in their own homes and communities. Mandatory nursing education included information on our Envision program and highlighted how it aligns with our nursing professional framework and Caritas. October 14th, 2014 was the first day we created more energy than we consumed. No other hospital in the world has achieved this. Nightingale rounds were created out of an idea and conversation in our Caritas Circle about Florence Nightingale and her desire to put the patient in the most optimal environment to allow for healing to occur. We realized how well this aligned with what we were trying to express about Caritas. Nightingale rounds occur several times a year in a forum where anyone in the organization is welcome and feature meaningful stories of caring connections with others. By connecting the stories to specific Caritas processes, Caritas comes to life. A few examples of stories in Nightingale rounds are a doctor sharing the lessons he learned from his patient, a patient's husband helping us to understand the effect of Alzheimer's on not just his wife, but the entire family, the value of pet therapy, and dealing with personal diversity as experienced through the eyes of a staff member. Reminding us all that caring is not only about patients and families, but about each other, Caritas Process 1, which promotes loving kindness for self and others, was the basis of our self-care carnivals. These events occurred in La Crosse, Alaska, and the region, and provided staff with the opportunity to come and learn about Caritas and experience caring activities. These included such things as having a hand massage, reflection, experiencing a finger labyrinth, learning about heart math, and more. Through reflective practice, we understand our behaviors and improve our skills and interactions with patients, families, and colleagues. On Reflective Fridays, managers come together to talk, enjoy lunch, and learn more about how they can incorporate reflection into their own practice and mentor their staff to do the same. Caritas is expressed through a variety of healing modalities at Gundersen. Essential oils are used with patients in most of our hospital patient care areas and several ambulatory and long-term care facilities. Patients comment on how they add to their healing when used for anxiety, nausea, and/or pain. Music is another powerful healing modality. To help deal with her grief after the loss of her son, Betty Baldner began playing the piano in the La Crosse and Unalaska clinic lobbies. Betty wanted to offer something to patients and their families that might help them heal on their own journey in dealing with illness or loss. Through a generous grant from our medical foundation, we helped Betty create a CD of her piano music in memory of her son. This CD is now available in all inpatient and ambulatory areas for our patients and families and can be sent home with families, if desired, after their loved one has passed. 2 editions of our Caring Journal have been published, each sharing stories and photos related to the Caritas processes that were contributed by Gundersen staff and offering pages for personal reflections. The Caritas Residency Program is led by our 2 Caritas coaches. Participants are given the opportunity to gain knowledge and wisdom about living Caritas in their own lives and to then share this with others. The graduates of this program commit to being a resource and design and implement a project that will carry Caritas to their colleagues and work environment. Examples of projects born from this work are presentations to respiratory care and the pulmonary department to engage staff in learning about Caritas and how it intersects with their work. A Caritas process is shared and discussed each month at the meeting of clinical managers in our inpatient and ambulatory care settings. A centering room has been created at the Unalaska Clinic where staff can take a moment for reflection, renewal, and refocusing in their busy day. Another way we share the meaning of Caritas is our internal communication. Monthly editions of nursing, certified nursing assistant, and medical assistant newsletters, as well as articles in our organization's weekly newsletter, share patient stories and connect Caritas processes to our practices. A display case by our cafeteria, set up during Healing Arts Week, was filled with ideas to inspire self-care, tying it to the Caritas processes. As participants in the Watson Caring Science Institute study, patients on our medical and surgical units and inpatient rehab are randomly selected to express their opinion of how we care for them. We are proud to say that not only are our scores reflective of caring staff, but that we are a beta site for collecting this data through the use of an iPad provided by the Gundersen Medical Foundation. Inpatient care orientation, which includes all staff who care for patients, Caritas is introduced through providing staff with the Caritas processes and doing an exercise in what is the meaning of a healing environment? What does it look like, sound like, feel like to you as a new employee? To the patient and their family. In centralized nursing orientation, nurses are asked why they chose nursing as a career. The stories of their journey are then aligned with the Caritas processes. Orientation for nurses who have recently graduated and are new to Gundersen continues through our nurse residency program. In 8 all-day sessions over the course of several months, participants are supported through their transition from school into professional nursing practice. Through enhancing their critical thinking and advanced assessment skills and emotional support, they are provided with the opportunity to gain knowledge and confidence in their practice. During this program, nurses learn more about Caritas through assignments that they complete during their education each day. They are asked to reflect on various aspects of what they learn from patient scenarios and topics. Nurse residents participate in a heart math session, which is interspersed with Caritas. Nurse interns come to Gundersen Health System from schools around the country, spending several weeks with us during the summer. They work side by side with nursing staff and learn firsthand how it feels to care for patients as part of a team. Caritas connections occur beyond the doors of our organization. A Caritas collaborative was created when the 2 Caritas coaches from Viterbo, the 2 from Gundersen, and Dr. Mary Lou Gerke and Stephanie Swartz formed a small group that continues to meet about 4 times a year to talk about how Caritas will live in our organizations and community. This relationship has fostered many connections. Gundersen coaches have been to Viterbo to teach essential oils and heart math. Viterbo coaches have been to Gundersen to teach the Caritas residency program. Many students from area schools expand their education through Gundersen programs. One example of this is our partnership with Viterbo University. Nursing students and their instructors spend time here for their clinical experience. Nursing Research on the Green is an annual spring event featuring nursing research and evidence-based practice projects, along with a keynote presentation by a visiting Dahlberg scholar and educational opportunities through breakout sessions. The purpose of this community-wide collaborative event, involving 8 organizations, is to promote utilization of evidence-based practice and research through the dissemination of research findings and sharing of innovative ideas. Through Global Partners, a program funded through Gundersen Medical Foundation, volunteers travel to Nicaragua, Ethiopia, and Pine Ridge, South Dakota. Community partnerships are developed with a goal of improving overall health, education, and quality of life. Volunteers with this program complete educational modules which have been designed to help them reflect on their experience and discover how Caritas aligns with their mission. We provide care to patients as though they are loved ones, and you have seen how Caritas guides us in meeting this commitment. The following commercial captures the essence of who we are, what we do, and how we care for each other.